Strength lies in embracing imperfect is my anchor. I'm thankful for the love of my family, the support of friends, and the lessons learned, both bitter and sweet. Life may not be perfect, but it's beautiful in its own way. It's a gift, a precious one, and I'm determined to make the most of it. So I'll keep fighting, keep growing, and cherish every moment, no matter how imperfect.
Hello everyone. Today I want to discuss about the attachments of this femur bone, right? Okay. Now you can see this is the right-sided femur bone, right? Okay. Now this what type of bone it is? It is a long bone, right? Okay. So what are the criteria of long bones? We all know the long bone in the shape. First of all, it is longer than width, right? Okay. This is the first criteria, and second criteria is the compositions, right? Okay. In the outer you can say in the outer aspect it contains for the compact bone, right? And in the lower end and upper end and lower end it contains for the spongy bone, right? Okay. So on the basis of compositions and on the basis of shape, we can define the long bone, right? Okay. So this is long bone, right? Okay. On the basis of the shape and on the basis of shape and composition, right? Okay. Take it now. And we all know in the compact bone, right, this is the what, this is periosteum, right? Okay. And in the periosteum, endosteum, and then what, then the in between the periosteum and endosteums we have the compact bone, right? Okay. And the inside the endosteums we have what, we have the medullary cavity, and that medullary cavity contain what, the ulo bone marrow, right? Okay. So that is in the shaft, right? In the shaft, then in the shaft, because it is mature bone, right? It is mature bone, right? That's why I'm telling this, right? In the mature bone, right, you can say in the shaft, right, the shaft contains the yellow bone marrow, and upper end and lower end contain what, the red bone marrow, right? Okay. Because there is a spongy bone, and spongy bones have some hole, right? Okay. And that holes contain what, the red bone marrow, right? Okay. Now we come to the attachment, right? Okay. You know the upper end, shaft, and the lower end, right? Okay. In the globular head, right, this is the globular head, right? Okay. And this globular head articulate with this shock head, right? Okay. And it forms what, the ball and socket joint. This is socket and this is the ball, right? Okay. And this is known as what, the ball and socket joint, right? Okay. Now we all know this, right? Okay. Now we come to the ball and socket joint, right? Okay. Now we come to the attachments in the globular head, right? Okay. Now you can see this pit. This is known as fovea, right? Okay. And this fovea, the one ligament attached to this one ligament attached to this fovea, right? Okay. What is this ligaments? The ligament is the ligamentum teres femoris, right? Okay. Now we come to the intertrochanteric area, right? Okay. This is the globular head. This is neck, right? Okay. Neck is what, the 5 centimeter. You can see, right? Okay. Now we come to the intertrochanteric area, okay. Now intertrochanteric area, the two trochanter are present, right? This is the lateral. This is the what? This is the greater trochanter, and this is lesser trochanter. You can see on the basis of size, we can call it what, greater trochanter, and it is lesser trochanter, right? Okay. In the greater trochanter, it has the three surfaces. You can see this is the lateral surface, right? Okay. And this is anterior surface, and this is what, this is a medial surface, right? Okay. In the lateral surface, it gives attachment to the gluteus medius muscle, right? Okay. In the anterior surface, it gives attachment to the gluteus minimus muscle, right? Okay. And in the and this is what, this is a gluteal tuberosity, right? Okay. In the gluteal tuberosity also consider the third trochanter of the femur, right? Okay. And gluteal tuberosity give attachment to the deep fibers of gluteus maximus muscle, right? Okay. So gluteus medius in the lateral aspect, and in the anterior aspect there is the attachments of gluteus minimus muscles, and in the gluteal tuberosity there will be the attachments of deep fiber of gluteus maximus muscle, right? Okay. Now we come to the apex of the greater trochanter, right? Okay. Now in the apex of the greater trochanter there will be attachments of piriformis muscle, right? Okay. And in the medial surface, in the medial surface of the in the medial wall of the medial surface of this, this is a greater trochanter, right? Then the attachments of what, you can see this fossa, right? Okay. This fossa, right? In this fossa there will be the attachments of obturator externus, right? Okay. And above that you can see the flat surface, right? Okay. And these flat portions give attachment to the obturator internus muscle, right? Okay. And the obturator internus and superior gamilla, inferior gamillus muscle, right? Okay. Now we come to the lesser trochanter, right? Okay. In the apex you can see this is the iliacus muscle, right? Okay. And this is psoas major muscle in the apex, and the iliacus muscle at the base of this lesser trochanter, right? Okay. So the two muscles are attached in the lesser trochanter, right? Iliacus muscles and the psoas major muscles and the iliacus muscle, right? Okay. Okay. Now we come to the line joining between the greater trochanter, lesser trochanter, right? Okay. So anteriorly the line joining between the greater trochanter and lesser trochanter, this is known as what, the intertrochanteric crest, right? This is what anterior aspect, right? Okay. This is intertrochanteric crest, and the posteriorly you can see this is what, this is known as the intertrochanteric crest, right? Okay, so the line joining between the greater trochanter and the lesser trochanter, posteriorly we call it is what, the intertrochanteric crest, right? Okay, okay. Now we come to the now we come to the intertrochanteric crest, right? Okay, in the intertrochanteric crest you can see this is the quadrate tubercle, right? Okay, now at the midpoint of this intertrochanteric crest there is the presence of what, the quadrate tubercle, right? Okay, this quadrate tubercle give attachment to the quadratus femoris muscle, right? Okay, now we come to the intertrochanteric crest, right? Okay, you can see the anterior aspect, there is the presence of intertrochanteric crest, okay, it gives attachment to muscles and to ligament, right? Okay, so one is what, one is the vastus medialis muscle, right? Okay, and vastus lateralis muscle, and two ligament, this is the capsular ligament of hip joint, right? Okay, and another one is what, the iliofemoral ligament, right? Okay, now we come to the attachments of this vastus medialis muscle, right? Okay, you can see the upper and the medial half, medial half of the intertrochanteric line, right? Okay, and it goes along the spiral line, okay, and continue as the medial leaf of medial leaves of medial leaves of linea aspera, right? Okay, and it goes along the one third of the what, the medial supracondylar line, okay, medial supracondylar line, okay. Now we come to the vastus lateralis, right? Okay, now lateral half of the vastus lateral half of intertrochanteric line, okay, and it continues as the inferior border of this greater trochanter, right? Okay, and then it goes along the lateral leaf of linea aspera, right? Okay, and the upper and the half of the linea aspera, right? Half of this border, right? Okay, so like this, in that way, right? Okay, there is the attachments of what, vastus lateralis muscle, right? Okay, see now, half of the shaft, right? Okay, take it. Now we come to the attachments in the surface, right? Okay, so we know, right, this is the medial border, right, and this is the lateral border. This is medial border, this is lateral border, and this is posterior border, right? Okay, and posterior border also known as what, the posterior border also known as the linea aspera, right? Okay, and posterior border forms two triangles. This is the lateral supracondylar line, this is medial supracondylar line, this forms surface, right? Okay, this surface known as what, the popliteal surface, and you can see there is also one triangle, right? Two triangle, one triangle inferiorly and one triangle superiorly. You can see this triangle known as the posterior surface, this surface known as the posterior surface, right? Okay, and this surface known as what, the popliteal surface, right? Okay, so in the posterior surface you can see this is the gluteal tuberosity. I have already discussed that, right? Okay, okay. Now we come to the attachments in the anterior lateral surface. Okay, so you can see the three-fourths of the anterior and the lateral surface give attachment to the vastus intermedius muscle, right? Okay, I have already discussed about the vastus medialis muscle, vastus lateralis muscle, okay. Now we come to the vastus intermedius muscle, right? Okay, so upper three-fourths of the shaft give attachment to the anterior and lateral aspect, anterior and the lateral aspect give attachment to the vastus intermedius muscle, right? Okay, and the below the attachments of vastus intermedius muscle, right? Okay, there will be the attachments of articular genu, right? You can see this is the articular genu muscle, right? Okay, okay, and it also attached with it also inserted in where the superior suprapatellar versa, right? Okay, we all know this, right? Okay, okay. Now we come to the attachments in the linea aspera, right? Okay, so the 9 structures are attached in the linea aspera, right? Okay, what are those 9 structures? The first one is what? You can see the vastus medialis muscle, vastus medialis, and then what? Then the medial intermuscular septum, okay. Then the adductor group muscle, like the adductor longus, adductor brevis, and adductor hamstring part of adductor magnus, right? Okay, then what? Then the posterior intermuscular septum, okay. Posterior intermuscular septum presence in between the medial leaf and the lateral leaf, right? Okay, and then the short head of rectus femoris muscle, okay, and then there will be attachments of short head of bicep femoris, right? Okay, then the attachments of what, the lateral intermuscular septum, okay, lateral intermuscular septum, then the what, the vastus lateralis, right? Okay, so these 9 structures are attached in the linea aspera, right? Okay, now we come to the popliteal surface, right? Okay, in the popliteal surface you can see in the supracondylar line, in the lateral supracondylar line there will be attachments of what? There will be attachments of plantaris muscle, okay, and here is the between the line joining between the lesser trochanter to the linea aspera, there will be the attachments of the pectineus muscle, right? Okay, here is the attachments of plantaris muscles, and here is the attachments of pectineus muscle, right? Okay, and we all know, right? And in the in the medial aspect, you know, medial aspect of the popliteal surface, there are the attachments of medial medial head of gastrocnemius muscle, right? Okay, and in here here near the attachments of the popliteal muscle, there are the attachments about the lateral head of gastrocnemius muscle, right? Okay, ठीक है ना? And we all know, right, in the lower head, right? Now we come into the lower head, right? Okay, in the lower ends, this is the lateral condyle, this is medial condyle, right? Okay, ठीक है ना? And this surface is for what? The patellar articulating surface, right? Okay, and this is for the tibial articulating surface, right? Okay, ठीक है ना? Okay, now in the medial condyle, you can say in the medial condyle you can see, right, this is the medial epicondyle, ठीक है ना? Okay, and medial epicondyle give attachment to the medial collateral ligament, right? Okay, and you can see this is the lateral condyle, okay, and this is known as what? The lateral epicondyle, okay, and lateral epicondyle give attachment to the lateral collateral ligament, right? Okay, and you can see this fossa, right? Okay, this fossa known as the popliteal fossa, right? Okay, and this popliteal fossa give attachment to the popliteal muscle, right? Okay, ठीक है ना? Okay, now we come into the anterior cruciate ligament and posterior cruciate ligament, right? You can see this is the medial condyle, this is lateral condyle, okay, and in between this there is fossa. This fossa known as what? The intertrochanteric fossa, right? Okay, because it presents between the two condyles, right? Okay, ठीक है ना? In the intertrochanteric fossa, you can see in the medial wall, ठीक है ना? The medial wall anterior inferior aspect, right? In the medial wall anterior inferior aspect, there will be the attachments of posterior cruciate ligament, right? Okay, and in the lateral wall the posterior superior aspect, right? There will be the attachments of what? There will be the attachments of anterior cruciate ligament, right? Okay, there will be the attachments of what? The anterior cruciate ligament, posterior cruciate ligament, and the attachments of anterior cruciate ligament, right? Okay, ठीक है ना? Now we come into the adductor tubercle, right? Okay, you can see the medial, right? Medial leaf continue as the what? The medial supracondylar line, right? Okay, and this medial supracondylar line in at the what? Medial supracondylar end at the you can see this is the adductor tubercle, right? Okay, and here is the attachments of what? The adductor magnus muscle, right? Okay, ठीक है ना? So hamstring parts of adductor magnus muscle attached in this the adductor tubercle, right? Okay, right? Okay, now this bones has total four secondary ossification center, right? Okay, and one primary ossification center, right? Okay, and this is at the midpoint of the shaft. This is the primary ossification center, right? Okay, and the three ossification center are present at the upper end, right? One is in the head, and one is in the greater trochanter, and one is in the lesser trochanter, right? Okay, and also the one secondary ossification center also the one secondary ossification center present in the lower end, in lower end, right? Okay, ठीक है ना? Now in the this secondary at the lower end, right? This secondary ossification center has a medico-legal important, right? Okay, because it appears at the 9 month of intrauterine life, right? And 9 month of intrauterine life, right? Okay, ठीक है ना? अगर बेटा किसी का भाई 9 मंथ अगर इंट्रायूटेरल लाइफ की अगर 9 मंथ हो जाएगा बेटा, तो होने के बाद बेटा ये जो हमारे सेकेंडरी ऑसिफिकेशन सेंटर है बेटा अपीयर होगा, ठीक है ना? ओके, सो रेडियोग्राफी में बेटे सेकेंडरी ऑसिफिकेशन सेंटर को रेडियोग्राफी में हम लोग इस सेकेंडरी ऑसिफिकेशन सेंटर को देखने के बाद बेटा हम लोग डिसीजन लेते हैं बेटा ये 9 मंथ की पहले बेटा इसका डेथ हुआ ना 9 मंथ के बाद इसका कुछ डेथ हुआ, ठीक है ना? तो उसको डिटर्मिनेशन करने के लिए बेटा इस सेकेंडरी ऑसिफिकेशन सेंटर को बेटा चेक करते हैं बेटा रेडियोग्राफी में, ठीक है ना? ओके, नाउ थैंक्स फॉर वाचिंग दिस वीडियो.